I'm pleased to be joined today on Health Beat by Dr. Tristan Hartzell, hand, plastic, and reconstructive surgeon with Faith Regional Physician Services, hand, plastic, and reconstructive surgery here in Norfolk. Today we're going to talk about tennis elbow.
Thanks, Rob. So tennis elbow is a degenerative tendinopathy that almost everybody gets as they pass through their middle ages. Some people take that as a compliment when I tell them that, and some people don't. But almost everybody, as they go through their 40s and 50s, gets some degree of tennis elbow. The tendon, as it attaches to the elbow, is gradually and partially tearing off of the bone there, and so it hurts. It drives people crazy. The vast majority, I see hundreds each year, we don't need to do anything for it. It just resolves on its own. It just takes time. It gets better and the body scars it in and it stops hurting after several months.
I see.
But there are a group of patients that continue to hurt. And so what we try to do first for them is non-surgical options. I put them in therapy. I strengthen other muscles in their forearms. We give them wrist braces. We just do conservative treatment options with anti-inflammatories, heat, and time. And we can outweigh a lot of those patients. But then there's still some that continue to hurt for whatever reason, and we don't understand why some people continue to hurt. So 6 months pass, and you can imagine people are getting incredibly frustrated. Every time they try and pick something up, the side of their elbow is hurting. So then we start talking about injections to make the pain better. Some people like platelet-rich plasma. We draw some blood off of them, we spin it down in a centrifuge, and we inject it into there. Athletes have made that popular. There's marginal evidence that suggests it may be better than a steroid injection, which is the most common thing I do because it's cheaper. And a steroid injection provides temporary relief. It doesn't change the course of the disease, but it makes it feel better. Beyond that, there's still some patients that continue to hurt no matter how many injections I do, no matter how much therapy, how much time. A year goes by and they're still miserable in their elbow. And those are the patients we start thinking about surgery. There's lots of different ways to do the surgery, but all the surgery is essentially the same, and then we go in there and we clean up the frayed tendon that's detaching from the bone.
Okay.
And sometimes we also reattach it back to the bone. It's a surgery that's very quick. Some of them are 5 minutes. Doesn't really go beyond 10 minutes. It's a quick, easy outpatient surgery. But the fact of the matter is most patients don't need to end up there. So that's why we drag our feet and don't go to surgery for everybody. The vast majority will heal on their own if we just give them enough time.
I see. That's pretty interesting. Well, thanks so much for joining us. And that's Health Beat, brought to you today by Faith Regional Physician Services.